What does an extraction and socket preservation look like 1 week after the procedure? Well, here's a real case from our practice in St. Charles, Illinois, where a patient came in and they had a tooth that was cracked on the back side of the tooth. Now, this particular crack extended very deep into the root structure, and you can see in the x-ray on the left where all that bone is darker around the root where the crack had been. That's actually an infection that's traveled into the bone, and on the right side picture you can see where the infection had started a little pimple on the back side of the tooth. The pimple is where the infection was draining. The only thing to do with a tooth like this is to extract it. So here you can see the day of surgery. We took the tooth out and then we used a cortical cancellous bone mix. It's a cadaver bone, so it's little particles that we filled the extraction socket with. So you can kind of see, especially up at the top, you can almost see the little particles. Over the top of that, we placed a piece of collagen that got red right away as blood flowed in. That's perfect. We want the blood to flow in and clot, and it holds the graft down. You can almost see our stitches over the top that's kind of holding everything down, and then you can see the knot over here. This looks great. It was perfect presentation. Everything went well during the extraction and the graft. 1 week later, the patient came back just for a post-op evaluation and to remove the stitches. And you can see the site is closing up really nicely. You know, for as infected as this tooth was, the tissue healing is really great. It's nice and pink as opposed to red and inflamed, hot, irritated, swollen. Those are the types of things that'll happen if there is an infection. You'll see big swelling, there'll be more major pain or sensitivity, and sometimes some drainage associated with it. But this patient looks really good. We took the stitch out, and then you can tell a little better after that. There's this white stuff kind of in that socket, and we get asked all the time, what is that? Is that infected? That doesn't look good. That's actually usually still that particle graft just slowly being integrated into the bone matrix that's forming. It's not mature bone yet, and this is really normal presentation. Some little particles might even still be falling out, and that's normal. The big things to watch out for are swelling, pain, and redness. But you're not going to be able to tell redness probably as easily as a patient, but you'll know if you're swollen, and you'll know if it's throbbing pain, like closer to 10 out of 10 throbbing pain. That can indicate an infection. You want to let your doctor know about that. But if it looks something like this, I think you're in good shape.